Hi guys, Dr. Ki here. I've spent thousands of hours working with patients with ADHD, and in this video I'm going to do a review of the medication Clonidine. I'm going to go through how it works, what are the key side effects to look out for, and how it's best utilized in the treatment of ADHD. Clonidine is traditionally used to treat high blood pressure, and it can be known under certain brand names such as Catapres, Kapvay, and Nexiclon XR. When Clonidine is used to treat ADHD, it's used most commonly for two reasons. The first one is to assist with insomnia, and the second one is to assist with symptoms of poor emotional regulation. In rarer cases, Clonidine can be used to treat the inattentive symptoms of ADHD, but this is typically if a patient cannot tolerate stimulants or atomoxetine, or the patient is still getting issues with symptoms despite maximal stimulant therapy. Another consideration with Clonidine is that it can be helpful in prevention of migraines and also helping menopausal symptoms. Therefore, if you're someone with ADHD and these comorbid conditions, it may lean you towards using Clonidine as a treatment option. For those that haven't heard the term stimulants before, this term is used to describe the medications that are typically the most effective when treating the inattentive symptoms of ADHD. These medications work by increasing two chemicals in the brain, dopamine and noradrenaline, in an area of the brain known as the prefrontal cortex, which is an area at the front of the brain, and this area of the brain is responsible for executive functioning. Examples of stimulant medication include Vyvanse, dexamphetamine, Adderall, Ritalin, and Concerta. Clonidine is considered a non-stimulant medication. So how does Clonidine work? Well, Clonidine is known as an alpha-2 adrenergic agonist. Being an agonist, it activates these alpha-2 adrenergic receptors in our brain, which helps to decrease the sympathetic activity in our body. The sympathetic nervous system is the system in our body that's responsible for the flight or fight response. The mechanism that's just been described is usually how Clonidine works in the lowering of high blood pressure, but with regards to the mechanism of how it works in ADHD, this is largely unknown, but there is some speculation that the activation of alpha-2 adrenergic receptors increases noradrenaline in the prefrontal cortex. So how do you take Clonidine? Well, Clonidine is usually taken as a twice-a-day dosing, once in the morning and once at night. Although you can just take it at nighttime, it is predominantly just for insomnia symptoms. Typical doses for Clonidine range between 0.1 milligrams to 0.4 milligrams as a total daily dose. So for example, if you took 0.4 milligrams, this may be 0.2 milligrams in the morning and 0.2 milligrams at nighttime. So what are the side effects? Well, the side effects that are most common that occur in at least 1 in 10 patients taking Clonidine include dry mouth, sedation, and dizziness. Less common side effects of Clonidine include depression, headache, nausea and vomiting, constipation, and erectile dysfunction. This occurs anywhere between 1 in 100 up to but less than 1 in 10 patients that take Clonidine. So who should not take Clonidine? Or what are the contraindications to Clonidine? Well, the main contraindication is anyone with a heart condition that causes a severely low heart rate. This may include conditions such as sick sinus syndrome and third and second degree AV blocks. So that's my summary of Clonidine and its use in ADHD. If you found this video helpful, don't forget to like and subscribe to the channel. If you're interested in another medication that's similar to Clonidine that can be used in ADHD, known as guanfacine, it's also an alpha-2 receptor agonist. I made the mistake in the video, I actually said antagonist, but it's actually an agonist. But yeah, if that interests you, check out this link here, and I'll see you in the next video.